Hi everyone, today we are going to start with new topic that is diuretics drug. Diuretic are a drug that increases the production of the urine in our body. Uh, these diuretic are useful in the treatment of the hypertension. These are useful in the treatment of the edema. Uh, and as we know that kidney is a main excretory organ in our body. Our kidney produce approximately 180 liter of filtrate per day, but 99% of filtrate, total filtrate, it get reabsorbed in our body, and only 1.5 liter urine is produced per day. This is a normal process of the urine formation. um, but diuretic are drug that increases the amount of the water that is lost from the body through the urine. And As we know that nephron is a main unit of the kidney. And here in the diagram, uh, you can see the nephron consists of the glomerulus. It is a Bowman's capsule structure. It consists of afferent nerve and efferent nerve. Then proximal convoluted tubule is there, and after proximal convoluted tubule, next is a descending limb of Henle, and after descending limb of Henle, there is a ascending limb of Henle, and after ascending limb of Henle, there is a distal tubule, and last part of the nephron is a collecting duct. In diagram, you can see the part which is in the yellow color. It is uh, it is of the proximal convoluted tubule, and the part which is in the white color, which is written as a uh, isotonic, it is a descending limb of Henle, and another part is a ascending limb of Henle, and next to that, the part which is in the blue color, which is marked with a sodium and chloride channel, it is early distal tubule, and last part is a collecting duct. So this is structure of the nephron. uh, and this diuretic drug, they increases the loss of the urine from our body by various mechanism. Their site of actions are different, and based upon their efficacy, they are classified as a highly efficient diuretics, then diuretics with medium efficiency, and low efficiency diuretics. So in high efficiency diuretics, they are also called as loop diuretics. This include the sulfonamide derivative like furosemide, bumetanide, then phenoxyacetic acid derivative like ithacrinic acid, and organomercurials like marsalil. Ithacrinic acid and marsalil, these drugs are not used nowadays that much, but furosemide and bumetanide, this drug used commonly. And this sulfonamide derivative are that much efficient that when they are given in the IV route, they show their action just in 5 minutes. They are very efficient drug, and drug with a medium efficiency, that is thiazide diuretic, hydrochlorothiazide, bendroflumethiazide. uh, this drug uh, and thiazide like diuretics, means thiazide like diuretics, their structure is similar to the their function is similar to the thiazide diuretic, but their structure is different. They are structurally different, and that's why they called as thiazide like diuretic. They are structurally different than the thiazide diuretic, but their mechanism of action is similar to the thiazide diuretics. And it include drug like indapamide, zypamide, metalazone, chlorthalidone. And next is a drug low efficacy diuretics. In low efficacy diuretics, carbonic anhydrase inhibitor like acetazolamide, potassium sparing diuretic like spironolactone, and direct inhibitor of the sodium channel like triametrine or amiloride. osmotic diuretic, that is mannitol and isosorbide dinitrate, and xanthine derivative, that is theophylline. So all these drugs come under the class of the low efficacy diuretics, and under medium efficacy diuretic thiazide diuretic come, and under high efficacy diuretic loop diuretics, they are also called as loop diuretics. The site of action of the loop diuretic is a ascending limb of Henle. Site of action of the thiazide diuretic is a early distal tubule. It is early distal tubule. And site of action of the carbonic anhydrase inhibitor, it is proximal convoluted tubule. And in case of potassium sparing diuretic, their site of action is late distal tubule. Uh, and osmotic diuretic, they act on the descending limb of Henle. So this is about the site of action of this diuretic class drug. In diagram, you can see in the diagram their locations, and their site of action. In this diagram I have mentioned their site of action in more simplified manner. uh, so one by one we will see the mechanism of action of this all drug. First class is a loop diuretic. Loop diuretic like furosemide, bumetanide, torsemide. This all drug come under the class of the loop diuretic, and their site of action is a ascending limb of Henle. In case of the nephron, when the filtrate is passed from the Bowman's capsule, it comes firstly towards the proximal convoluted tubule, and in proximal convoluted tubule about 65 to 70% of the filtrate is reabsorbed. Different type of ions like sodium, potassium, water, glucose, organic amino acid, all these components are absorbed in the proximal convoluted tubule. uh, and the filtrate which form in the proximal convoluted tubule, it is isotonic. Uh, uh, so and uh, once it pass from the proximal convoluted tubule, it come towards the descending limb of Henle, and from descending limb of Henle it come towards the ascending limb of Henle. So loop diuretic act at the ascending limb of Henle. Their site is ascending limb of Henle. And as you can see in the diagram, in ascending limb of Henle, there is a sodium potassium 2 chloride channel. Sodium potassium 2 chloride channel is present in the ascending limb of Henle, and it is responsible to reabsorb the sodium in large amount, because uh, the water is mostly absorbed in the descending limb of Henle, and whatever the remaining electrolyte content, it is absorbed in the ascending limb of Henle. So ascending limb of Henle is the main site of the absorption of different electrolytes like sodium, potassium. So this loop diuretic, when act on this sodium potassium 2 chloride channel, automatically the process of reabsorption of the sodium from that site, it is inhibited, and that sodium is lost from the body. And always remember, when there is a loss of the sodium from the urine, along with that sodium, water is also lost from our body. Whenever there is a loss of sodium from our body, water is also lost from our body. Along with that, that is the phenomenon of the natriuresis. Natriuresis means loss of sodium, and natriuresis is always done with a diuresis. So these phenomenon are related with each other, they are not different. Whenever there is a natriuresis occur, along with that diuresis also occur. So this is about the loop diuretic mechanism of action. This loop diuretic drug, they bind to the sodium potassium 2 chloride channel, and they completely block it. And along with that, furosemide is a weak carbonic anhydrase inhibitor. Carbonic anhydrase inhibitor, it is carbonic anhydrase, it is enzyme that is responsible for the production of the H plus ion. and once it is inhibited, the production of the H plus exchange of the H plus ion with sodium, it is inhibited, and that's why loss of sodium occur through the urine, and along with that more water is lost from our body. So this is about the mechanism of action of the loop diuretics. Then second is a second is about their adverse effect. Adverse effect is of furosemide when given with a aminoglycoside category drug. Aminoglycoside category drug are protein synthesis inhibitor drug. They inhibit the protein synthesis, and when furosemide is given with a aminoglycoside category drug, it causes severe ototoxicity. Ototoxicity means uh, inability to hear something. It is problem associated with our ears. And furosemide, it causes the hypokalemia. Hypokalemia means loss of potassium. It is also responsible for the hypomagnesia, means loss of magnesium. Deficiency of the magnesium occur, and hypocalcemia means loss of calcium from our body. Means along with sodium, the other ions like calcium, then potassium, they also lost from our body. Hyperuricemia means drug like furosemide are responsible for hyperuricemia, means increased level of the uric acid. That uric acid, it is responsible for the joint pain. So these drugs are avoided in the patient, in gout patients. Okay. So this is about the highly efficacious diuretic drug. Then next is a thiazide diuretic. Thiazide diuretic include drug like hydrochlorothiazide, bendroflumethiazide, or thiazide like derivative, that is indapamide, zypamide. This drug come under this class. Their site of action is different. Their site of action is a early distal tubule. Early distal tubule means, you can see in the diagram, their site of action is a early distal tubule, and the late distal tubule, it is a site of action of the potassium sparing diuretics. In early distal tubule, this thiazide diuretic are responsible to block the sodium 2 chloride channel. Sodium 2 chloride channel. Through the sodium 2 chloride channel, sodium is reabsorbed. Because the sodium, when it is reabsorbed, it come to the sodium deficient cell, and it is provided to that sodium deficient cell. But when the sodium 2 chloride channel, it is inhibited, automatically reabsorption of the sodium, it is inhibited. Loss of sodium occur from the urine, and along with sodium, water is also lost from our body. So thiazide diuretic, their site of action is a early distal tubule, and their mechanism is blocking of the sodium 2 chloride channel in the early distal tubule. And thiazide diuretic are also responsible for the hypomagnesia. They are responsible for the hypokalemia, means deficiency of the potassium. But in contradiction to the furosemide like drug, means a loop diuretic drug, thiazide diuretic causes hypercalcemia. Hypercalcemia means increase in the reabsorption of the calcium. Because loop diuretic causes hypocalcemia, and thiazide diuretic causes hypercalcemia, means increase in the level of the calcium. And adverse effect, the main adverse effect that is associated with the thiazide diuretic is the impotence. So because of that, it is avoided in the young males. And as we discussed, that thiazide like diuretic, they have mechanism of action similar to the thiazide diuretic, but they are structurally different. Then next class of drug is a carbonic anhydrase inhibitor. Carbonic anhydrase inhibitor drug, the prototype drug of this class is acetazolamide. Acetazolamide, this drug, it is used in the mountain sickness. It is used in treatment of glaucoma, as well as it is used as a diuretic. Carbonic anhydrase, it is responsible uh, to convert the CO2 and H2O into the carbonic acid. And carbonic acid, it again break down into the H plus ion and CO3 minus. That H plus ion is exchanged with a sodium ion, and the H plus combine with HCO3 minus and form carbonic acid. Carbonic anhydrase inhibitor inhibit the exchange of the H plus with a sodium, and that's why sodium it is excrete out from the urine, and along with that loss of water occur from the body. uh, because the H plus ion remain as it is in the blood, it remain as it is in the blood. This drug like acetazolamide are responsible for metabolic acidosis. As we know, H plus ion means those as Lewis acid theory, that more the those agent that give H plus ion, they are acidic in nature. More is amount of the H plus ion given, it is acidic in nature. So drug like acetazolamide, they are responsible for the metabolic acidosis. And Next class of drug is potassium sparing diuretics. Potassium sparing diuretic, the drug is spironolactone. Spironolactone, it is a drug that consists of the steroidal nucleus, and its active metabolite is candrinone. And their site of action is a late distal tubule. In late distal tubule, there are aldosterone receptor, and in normal physiology, aldosterone bind with that aldosterone receptor in the late distal tubule. It produces the aldosterone induced protein, and this protein are responsible to cause increase in the reabsorption of the sodium from late distal tubule. But this normal physiology, it is uh, inhibited by the potassium sparing diuretics. And these potassium sparing diuretics, they inhibit the binding of the aldosterone with aldosterone receptor competitively. These drugs are competitive antagonist of the aldosterone receptor, and so the reabsorption of the sodium cannot occur. And this drug, they causes the retention of potassium in our body, and that's why they are called as potassium sparing diuretics. Means they spare the potassium in our body, so they are called as potassium sparing diuretics. This drug are responsible for impotence in male and menstrual irregularities in female. This is main adverse effect that is associated with a potassium sparing diuretic. And directly acting renal epithelial sodium channel blocker. uh, Two names are there, that is triametrine and another is the amiloride. These two drugs come under the class of the directly acting renal epithelial sodium channel blocker. Means this drug directly inhibit the sodium channel in the luminal membrane of the distal convoluted tubule. Means their site of action is near to the site of action of the potassium sparing diuretics. They inhibit the sodium channel that is present in the distal convoluted tubule. And remember that triametrine is not that much potent, but amiloride is 10 times more potent than the triametrine. And amiloride, it is used in the treatment of the lithium induced diabetes insipidus. Means actually lithium, it is metal, and that lithium, it is reabsorbed in the kidney from that sodium channel. So when that sodium channel inhibited, the reabsorption of the lithium is also inhibited. So this drug are used in the treatment of the lithium induced diabetes insipidus. uh, so this is all about the all diuretic drug, their mechanism of action, and their site of action. uh, One by one we will revise again that classification, that is highly efficacious diuretic, that is furosemide, bumetanide. Bumetanide is 40 times more potent than furosemide, and a site of action of this drug is a ascending limb of Henle. Ethacrynic acid, marsalil, this drug not used nowadays. This drug, they block the sodium potassium 2 chloride channel in ascending limb of Henle, because ascending limb of Henle, it is a main site of the reabsorption of the electrolytes in overall structure of the nephron, and this process it is inhibited by the drug like furosemide. Then next category of the drug, that is medium efficacy diuretic, that is hydrochlorothiazide or bendroflumethiazide. This drug, they act on the early distal tubule, they act on the early distal tubule, and they block the sodium 2 chloride channel. Sodium 2 chloride channel is again, it is involved in the reabsorption of the sodium, and whenever there is a reabsorption of the sodium in our body, there is a retention of the fluid in our body along with that, because it is a tendency of the water that wherever the sodium goes, water also goes along with that. So when the loss of sodium occur in our body, along with that water loss also occur in our body, means natriuresis and diuresis. Natriuresis is loss of sodium and diuresis is loss of water. So these two things come, they always happen together, not in different manner. And one thing remember that diuretic drug, when given with a non-steroidal anti-inflammatory drug, the effect of the diuretic drug, it is blunt means it is abolished, because non-steroidal anti-inflammatory drug, they are responsible to decrease the synthesis of the prostaglandin. Non-steroidal anti-inflammatory drug, they decrease the synthesis of the prostaglandin in our body, and prostaglandin are involved in the increase in the diuresis process. So when prostaglandins are not synthesized in our body properly, automatically the loss of urine cannot occur from our body, and that's why the effect of the diuretic drug, it is blunted by the non-steroidal anti-inflammatory drug. Then third important drug is a potassium sparing diuretic. Their site is a late distal tubule, and in late distal tubule this drug bind with a aldosterone receptor, and they block the action of the aldosterone competitively. And the drug with a medium efficacy is a carbonic anhydrase inhibitor. Carbonic anhydrase, it is responsible for production of the H plus ion, and that H plus ion, it is exchanged with a sodium ion, and this process, it is inhibited by the carbonic anhydrase inhibitor like acetazolamide. uh, and a drug like mannitol, they create the osmotic pressure, and that by creating the osmotic pressure, they uh, increases the fluid volume of the urine. Mannitol, then isosorbide dinitrate, this drug come under the class of the osmotic diuretic. And mannitol, it is used as a sweetener, and it give the in tablet preparation. And mannitol give the cooling effect, it is a sweetener with a negative heat, and it is especially used in the chewable tablets. So this is all about the diuretic drug, their mechanism of action, their site of action, and along with this, their drug-drug interaction is also important, especially in case of loop diuretics at when given with a um, aminoglycoside category drug, it causes ototoxicity. Then they are responsible for the hyperuricemia, so contraindicated in patients of the gout. And thiazide diuretic is also responsible for the impotence in the male. And next is a carbonic anhydrase inhibitor. These are useful in the treatment of glaucoma, mountain sickness. and potassium sparing diuretic, they are responsible for the menstrual irregularities and impotence in the male. They are responsible for the dangerous hyperkalemia. This is all about the diuretic drug. Their classification is important, and their mechanism of action, their site of action, all these are important point. Thank you.